The pair, despite the risk of being kidnapped in some troubled African countries and the harsh weather conditions on the continent, have taken up the mission of combating malaria in Africa. When British national David Robertson was 18 years old, his life changed drastically after he was involved in a severe car accident. To save his life, doctors amputated his arm and leg. His mindset changed after that, and he decided to travel around the world after he sold his house and bought a Range Rover. He traveled from Bedford in England through Algeria and drove across the Sahara Desert and through swamps in Central Africa to Cape Town, South Africa. While in Kenya, he suffered shivers and pains, and he was diagnosed with malaria. This is when he realized that not much was being done to fight malaria, a disease that claimed the hundreds of thousands of lives in Africa every year. Robertson felt the need to create worldwide attention on malaria by holding media conferences and engaging various governments in Africa. He launched his campaign called Drive Against Malaria in 1999.
Malaria is now on the agenda, the political agenda, and malaria rates are really going down because mosquito nets are being distributed everywhere in Africa now. There are millions. Malaria rates has gone down from over 1 million deaths per year to around about 600,000 deaths per year, which is still too high.
From 7,000 deaths per year at independence to just 10 deaths in 2013, Namibia is amongst the African countries Robertson is referring to as an example. Julia Samuel works with Robertson in trenches and sometimes in conditions of civil unrest to combat malaria. In 2013, during a coup d'etat in Central African Republic, Robertson and Samuel were held hostage by armed Seleka rebels while on a mission to help malaria patients in remote villages.
They held an AK-47 on our head for 24 hours. And one of the rebels decided to let us go because I have treated him and his children for malaria. Maybe there was still some goodness in his heart.
But despite the distressing experiences, the team is determined to make a difference in the lives of forgotten African communities, many of whom have no access to health facilities but live close to mosquito breeding grounds.
There's no rebel who can stop us. There's no Seleka rebel or Boko Haram where we can confront it now in Cameroon who can stop us to help the people. No, we continue.
You know, the combination of governments working with the private sector we're going to knock malaria on the head, and one day the whole of Africa, malaria will be eradicated.
Robertson has his leg and one of his hands amputated, but he says he will extend the other to help those vulnerable to malaria by training and educating African communities how to diagnose and treat malaria. The African region accounts for 85% of malaria cases and 90% of malaria deaths worldwide. Renate Rengura, NBC News at Swakopmund.